there, my name's Amrita Krishnan, and I'm the director of the Judy and Bernard Briskin Center for Myeloma at the City of Hope in California. So I'm very excited to let people know that we are opening a trial through the Southwest Oncology Group, SWOG, and it's also through the BMT-CTN, so basically the largest transplant network in the country. And that trial is called SWOG S1803. And it's answering the questions that patients have asked us the most, which is, how long do I need maintenance therapy? And also, what's the best drug for maintenance therapy? So in this trial, patients can enroll either before their transplant or after their transplant, and they will be assigned to an arm. One arm will be standard maintenance with lenalidomide. The other arm will be maintenance with lenalidomide plus subcutaneous, so as an injection, daratumumab, the anti-CD38 antibody. Patients will stay on that arm for 2 years. They will have MRD, so minimal residual disease testing by the most sensitive tests by next generation sequencing done at 1 year and then at 2 years. At 2 years, patients who are MRD negative, so by the deepest test be hopefully in remission, will be re-randomized, so have a chance to stop maintenance, and some of them will continue maintenance. So we'll answer for us 2 questions. Is adding daratumumab to lenalidomide better for maintenance? And it'll also answer the question, if you get a very, very deep response, i.e. MRD negative, can you stop maintenance? So we're very excited, and we'd really encourage patients to participate. This trial allows patients up to the age of 75. And as I said, we can enroll patients either before the transplant or within 120 days after the transplant. So we try to make it as easy for patients as possible.